Morning, everybody. We'll get going here in a minute. I'm just getting some admin stuff and tech stuff taken care of here. Thank you. I'll take this time to do a mic check with Greg, one of my guys that's on here. We okay? You hearing me fine, Greg? All righty, successful mic check. So good morning, everybody. I'm Chris Evans, the Acting Director of the Bureau of Recovery and Mitigation here at PEMA, Pennsylvania Emergency Management Agency. We're out of Harrisburg. In the room, I've got Russ, John, and Kevin, and Greg is online. We'll explain his role here in a little bit. But as you notice, the names I've got Kevin, John, and Russ are the folks that you got as your contacts in the email message the other day that are going to be your PEMA specialists through this. I want to welcome you to your applicants briefing. I know you've been waiting for this to get going for the PNP healthcare. Thank you for your patience. We were busily taking care of the 500 or so municipality, local governments, volunteer fire companies that had no other grants other than what we can give them here in the public assistance program with FEMA and PEMA. So while you're getting your cares and getting that all straightened out and figuring out where that was going and then getting the messaging on the different policies from FEMA, which is good that we took the time. We got that good policy paper out that we'll take care of today and talk about. So that gave us time to get the other folks in and going. And now we're ready to get you going. Thank you very much for everything you're doing out there for your residents. You as the financial people kept the lights on for your staff so they could take care of our residents. And thank you very much for doing that. We saw a lot of good things happening from here at PEMA. So this is to take care of your costs. It's going to be about an hour and a half. This is my 22nd federal declaration of public assistance with FEMA. So we've got a little experience here at PEMA with it, along with the 4 gentlemen that'll be helping you through this process. And that's what we're here for at PEMA. We are your advocate. We are here to make sure everybody plays by the rules, that you, the applicant, identifies and receives every eligible cost under the program that you are entitled to. And that's what the guys here at PEMA and FEMA. We have FEMA on the line listening in. They have been here with us, quarantined at times in PEMA, lockdown, since day one. A few of them are working remotely very successfully, but they have been with us since day one of this event and have been working through the whole process with the other public entities, the municipalities, school districts, authorities, volunteer fire companies. So we had a few bugs. We've been able to work them out. Another good reason why, for your benefit, We've been able to sort things out, and as we have a few other things that are healthcare related to sort out as we go through this, being all new. We've all got to keep in mind, typically this program works very well in a flooding event where we get a disaster and we go out and do the assessments and get the federal money to help rebuild roads, bridges, homes, schools as we have in the past. This is all new to us doing a pandemic. So thank you for our patience with this. And we've got a few things we'll talk about today that we just don't know that have come up in yesterday's conversations with your partners. We had about 137 participated in the overall in the two programs yesterday. Some good questions. As we go on, Greg is sitting off remotely, ready to answer your questions as we progress through these slides. Typically, we do this briefing in person. We'd be set up in a school auditorium, a fire hall, your county EOC. Obviously, we can't do that right now, so we're doing it this way. So we have, we would take questions as we go on the slides instead of holding them to the end. So if there's a question on a specific slide you have, go ahead and ask it in the chat room. Greg's there to answer. FEMA's also watching, so they can chime in if Greg needs a lifeline, or if I do, because I will also be answering questions at the end. If we get through the slides and we have not answered your question, you have some nuance, that's what we're going to handle at the end, and we'll keep the line open here and go as long as you have questions to ask. So again, it sounds like we're all muted, not hearing any reverb on my end, so we're going to move on here. So the DR, that's the disaster relief number, is 4506. That's a designation that we have for Pennsylvania. Again, it's for the emergency protective measures, those actions, and subsequent costs that you had and are continuing to have as a result of COVID-19. Your applicant's briefing here is the official kickoff of the program, something we do, the state's responsible for doing. And we administer the program. It's FEMA's program. We administer it and also participate in the funding. But this is our first required briefing that we must do after every declaration. If you're listening in and watching this morning because you had a friend or colleague send you the link and registration information, in other words, you are not receiving messages directly from us here at PEMA that we have put out the last couple of weeks to the healthcare entities, private nonprofit healthcare entities. If you're not receiving those emails, it's because I do not know you exist and that you have not completed our survey 1, 2, 3, the 7 questions that we have in an online survey. If you have not done that, we need you to, after this briefing, get a hold of your county emergency management agency and ask them for the PEMA survey 1, 2, 3 information and link. There's 2 Word documents, one on eligibility for this event, the other one is about the survey, and then within the email itself is the link to the survey 1, 2, 3. And we're going to be shutting that down shortly now that we're off and running. So if we don't know you exist, we're not going to be able to help you, because to get you in the into the system as a PNP applicant, we must officially invite you, which we will discuss here in a little bit, in an email. If I don't have a contact for you, I can't email you. So you're not going to get the invite. So please, if you haven't taken care of that yet, please do. Some dates for you. We'll talk about them a little bit as we go into some other slides where they come into play. declared on March 30th, but we backed up the incident period. This is the incident period is where eligible work is done and can be reimbursed for. So any work you had eligible work before the 20th probably is not, but if you do, we'll talk about it. But there's no end date right now. It's continuing. Typically on a flooding event, you have, if we know the flood's going to happen, it's a couple of days before the flood to a day or two after the flood subsides. And that means that's where all the damages had to have occurred. Obviously, we don't have, other than to the body, we don't have physical damages in this, but it's an ongoing event, and we have no idea right now where that end date will be. The sooner the better. So it's for the only emergency protective measures. There's, you can see a category B. There's a few other categories that are more relevant in a flooding or storm event that we're not going to get into. Of interest, this is a fully reimbursement grant for your incurred costs. 75% of the funds come from FEMA, 25% come from the Commonwealth. So as you're going to notice, I am not a slide reader. You've got the slides in front of you for reference. So you can look back at them. Some slides we'll just going to touch on and move through. Others will hit the high points, and others will spend some time discussing. But if you've gone ahead and cheated and looked ahead on the slides thinking, my God, this is going to be a painful process, hopefully not. I'm not going to be a big reader. So for the program, we have four eligibility criteria that must be satisfied. We'll talk about each of these today. The big one, which was of interest for municipalities, fire companies, is FEMA's minimum cost. You must have at least $3,300 in eligible costs in order to participate for the reimbursement. Some municipalities, fire companies have or had trouble reaching that. It's again because the incident period is ongoing. They have the opportunity to continue incurring costs that can reach to that. I don't think that's going to be an issue here with the healthcare, but certainly if you are having those issues, we don't want to scare you off. That's why we did not purposely tell you that earlier. We did not want folks to be scared off because many times in the past, we've been able to find other costs that were eligible once we get to talk with the applicant. So if you are having those issues, get a hold of your contact your PEMA specialist, either Russ, John, or Kevin, and talk to them about it. And we'll see. Again, though, it's continuing, so if you're not there yet, there's a chance that you may get there yet later on. So first, we got to work on getting, the first thing is the applicant an eligible applicant. So we have the private nonprofit, medical facility, healthcare providers, and their facilities, along with these here. Other folks for this, like I said earlier, was in the program are your county government, local municipal governments, school districts, authorities, and other certain private nonprofits, most of them being the volunteer fire companies. Do have a couple of negative slides. I apologize, but it's important everybody has the correct information. So when we get into ineligible applicants, they fall into these categories. If you're listening in and you fall into these categories, you have our PEMA contact. Get a hold of them, and we can discuss it further with you to clarify whether you are or not eligible. So we have the eligible applicant, and that's what we'll work on. We'll have the slides here later on with the portal, where we do your official signing up in there. We get you the invite, you get your profile set up, and turn in your PNP paperwork. That'll be your process for determining that you are an eligible private nonprofit applicant. FEMA has a few extra steps for you that they have private nonprofits do to ensure that they are, in fact, an eligible applicant. You don't want one in there that then turns out later where we've wasted a lot of your time. So we'll work through that process with you in FEMA. So you have the eligible applicant. They must have control over an eligible facility as defined here. As I said, owned and active use at the time of the disaster. The only caveat on that is if we had some buildings that were mothballed that we turned into the alternative care centers. So that's a little bit of a tweak in the program. It's not in the program. It's not all black and white. There's some gray area that we all dance in when need be to make things eligible. And we will work with that on you where we need to. So you have this policy. We sent it out via our messaging. You're receiving our messages. You've got the policy. It's and this is turns into one good reason why we had the wait time getting you into the system, because we were able to get this policy that clarified a lot of things for you. Whether it be good or bad, but at least we had the clarity on what they're having as eligible costs, where they come into play. Because again, you have many funding sources, so you're having to maximize each of them and deciding at your level there, which grant's covering which of my eligible costs. And we'll talk about that a little bit more in the future, and make sure we're not commingling or double dipping. But I'm not going to get deep into this policy in this program. You have it there for your reference. It's available on our website. Links will be at the final couple of pages. And another link to the FEMA site also we'll have for you here at the end. So it's something, if you haven't seen it and looked through it, please do. Just a few of the eligible work under emergency protective measures for you, coming out of the earlier eligibility sheet, but then also out of the policy. Talking to a lot of folks, it's going to be the purchase of the PPE, the reconfiguring of your hospital, things like that, that we're going to be talking about. Last bullet, disinfection of eligible public facilities, where you did. We did not, in this COVID environment, we did not clean facilities. We disinfected them or decontaminated them. Disinfecting is our key word. We learned that about a week ago when an applicant municipality had in there, as we'll talk, description of work, which we'll get into for you later. Their description of work was that they cleaned their facility. And for the folks downrange of FEMA that are reviewing these, they needed to have clarification as to, were you cleaning it with a Swiffer or were you disinfecting with Clorox? So we're throwing out the word cleaning facilities. Please use in your descriptions when you come into those particular things that you were disinfecting them. Things we're learning along the way. A couple of slides about non-congregate. Typically after a flood, we'll have the congregate sheltering. We'll set up, we have the gyms set up, fire halls, Red Cross is there setting them up where it's a big room with cots. Obviously, we could not do that in this event. You'd have to have 40 feet per cot versus 10. So we've been using non-congregate where needed. Basically, it's hotel rooms, dormitory rooms, where you are in your own space. We did work with a few hospitals and the counties for setting some of these up for staff, and we had some set up for folks that were exposed and or positive and had no place else to go or could not go back home. So we have pretty much all these up and running that we have used. If we have the ability here at PEMA, you work through your county. If in the future we need to do these, hopefully not. But we have the ability now at PEMA. We've been given the blessing by the FEMA Regional Administrator, Mary Ann Kearney, to approve under specific guidelines of operation for those that need it. So I think we have those up and running that we need, but if something gets turned around here in the future, some of the things that we need you to do and what we need to work under to get one, but start through your county emergency management agency if in the future you need one. Some other eligible work definitely fell under the local government things, but some of these things also you may found that you were doing yourself too. So we have the eligible applicant, doing eligible work in an eligible facility. And then the last part, more important to you folks, are costs. What costs that you have that are going to be eligible. So they fall within these. Labor, and we'll get into each one of these here in the next slides. I'm not going to get ahead of the slides. So with all those, the costs fall into these two, reasonable and necessary. Reasonableness is a little bit more flexible in this. We saw market prices being raised due to demand and limited supply. So we'll have to be cognizant of that as you're turning in costs if you had any issues with that. Again, documenting them. I've talked to a few of you already out there. In your normal environment, you document your costs anyways very well. And we'll talk about those a few times and what you're going to be turning in, but having that proper documentation on the different aspects of this is going to be very important. You know, and if you have the document that gives the information FEMA needs, there's no need that we're not going to need to transpose your information onto their forms. We'll talk, and you'll see later on, they do have some forms out there to use. But from talking to a few of you, I think what you already have out of your systems, what it's going to be able to print out once you see what we need, what FEMA needs, that you're going to be able to just get that information. It's pretty simple stuff out of your own systems. So for your labor, as we said, in this for emergency protective measures, only the overtime hours for your permanently scheduled employees are eligible. So if they're on the schedule, let's say their shift was 8 to 8, like ours were here for a few weeks. My 8 to 4 was at straight time, not eligible for reimbursement, but the 4 hours, 4 to 8, would be. Even though I was doing a little different job than I normally do, being in the watch center, but it was still, there was no extra cost to the Commonwealth for my scheduled hours. It was already budgeted and scheduled. There was no extra cost. And that's what we're looking at, is what extra cost for eligibility that the pandemic has done for you. So for your temporary call-ins, all their time is. They weren't budgeted. They weren't on the schedule. You called them in extra. So it wasn't extra cost to you, so all their time and fringe benefits would be eligible for you. And again, we can get into particulars with you as you start working through your projects and having discussions with FEMA and your PEMA project specialist. We can get into individual nuances you may have, but if you think it's overreaching to everybody that we didn't cover, please ask the question. Your payroll folks, probably within your department, know what fringe benefits are affected by the rates, especially your overtime. So they're going to be your best asset to figure that out. At a minimum, the last bullet, you have the 7.65 to put in for reimbursement along with the labor rate. Equipment. This is one of the nuances of pandemic, working with healthcare like this. We found yesterday, once we got into it, typically after flood event, we have what's the hourly rate for the loader and the grade all, repairing the roads and bridges. What's the cost of the plow, the truck, the plow, and the spreader for a snow emergency declaration, the hourly rate for each. We don't see a lot of hourly rates for equipment in your facilities that may be eligible for reimbursement under the program. So I know FEMA's identified it, and here at some point here we're going to have those discussions as to what is, and then those rates. Typically it's easy with that front loader, snow plow, you have an operator. Pretty easy to say Bob Smith was in the plow for 12 hours pushing snow. May be more difficult for you to match an operator to that equipment. So that's another discussion that we're going to have and figure out how we address it. Bought equipment you purchased that is eligible under the program, its use. If you outright purchased things versus rented, and it was over $5,000 at the end, after its use is done, the incident period's closed, FEMA is going to look at, okay, the incident period is closed, use of that equipment is no longer being reimbursed. What is its fair market value? If you were to put it out to sell, what could you get for it? So if that $10,000 piece of equipment has a resale value now at the end of $2,000, you're only going to get $8,000 from FEMA and PEMA for it. Again, things we can discuss, when is it over? Is there really a fair market value to it? How is that determined? All things to be determined as a case by case. So you have your labor costs, your equipment costs. Now we have your materials, your PPE, and anything else, the cleaning supplies, rags, sprays, whichever. Again, what it was used for, and we'll get into this descriptive thing more, but we'll see it here, is, what was it? What was it used for? Of importance is the permanent buildings. You had temporary facilities set up, which some of you did outside your buildings that were being disinfecting. FEMA's environmental folks are wanting to know, really got to take interest on those temporary facilities because they don't have a normal sewer hookup or runoff. So what materials were you using to clean with? And was there any thought of potential environmental issues with them? So there'll be things that you'll have to be prepared to discuss down the road. Again, more information you give up front, now that you're understanding things they're looking for. And again, we'll get guidances out from them. But in your permanent buildings, the disinfecting, things are going into the drain, into the sewer system. They're more concerned of runoff on the temporary facilities. Oh, sorry, CoStar's contract. I meant to take that out yesterday. This was more something for local governments use. They get together, 20 or so different governments get together and buy things in bulk. They'll get together and buy 100 tons of salt and then divvy it up amongst the 10 of them. You may have your own within the healthcare industry. I didn't see any mention of it yesterday in the discussions afterwards, but I know you're not participating in the CoStars. Contracted and rental services. Again, all tied to the pandemic, all tied to emergency protective measures. Again, in the descriptive, what was the service they provided and why? What did you rent and why? Rental equipment is not like your own equipment. We do not use the FEMA equipment rates on rented equipment. The rental cost is the rental cost. Whereas the equipment cost takes care of service and gas, the rental cost is the renting of the equipment and whatever. I'm going to guess there probably, unless it was an outside generator, I'm going to guess there probably wasn't any gas, so it's going to be electric. And I've never seen any real equipment reimbursement for electricity. But we'll do the full rental cost for the period that the item was used for eligible work. So we're going to need that invoice showing what it was, time it was used, and the cost. And if you have it, proof of payment, canceled check, something to show, which we'll talk about a few times here, is the proof of payment. And again, this is the reimbursement program. Our first, and we'll get into the projects and all a little later near the end, but this is a reimbursement of your incurred costs. And then the cost of future will be things we'll discuss in the future. Big important thing, number one to you, first bullet, but talking to those that I have been having discussions, that's where your CARES funds was going to. You didn't have elective surgeries, so the regular surgeries, unscheduled, but needed. So you did definitely have loss, and that's what the CARES, where you were putting majority of your CARES funds to. So again, we're going to need to know what you got, where it went, which we'll talk about here in a little while. And again, just keeping those things that you're turning in. We're starting to see some of our other bigger applicants just turning everything they have under the sun in and letting us sort it out. That is going to greatly delay. If you know out of the briefings and you're hearing things that are not eligible in the program, it's going to delay, and you turn them in anyways, it's going to delay the progress of your project through the system. It's going to recreate that the project stops, gets put on the sidetrack, and we issue, or FEMA issues what we call, and we'll talk about a few times, a request for information, an RFI. And you're going to have to explain why that particular item, how. Sometimes it's relevant. If it's a gray area, definitely. That's why we want to talk about it ahead of time. But when you know things definitely aren't eligible under the program, they fall in under the ineligible costs. If you turn them in, it is going to slow things down. Documentation, documentation, documentation. Like we talked earlier, FEMA has portal resources, but again, you can summarize your labor, equipment, materials, contracts, and rentals on your own produced documents out of your own systems. You can say who worked when, where, their labor rates. We're going to get all these other things. You're going to get together for us, your contracts, pay policies for time and a half, whether it talks about double, whether you talk about hazard pay, as some of you we talked of. You know, there are provisions. It's great if it's in your policy. If it's not, who authorized it, under what conditions, for what? You know, then we can get into its eligibility also. PEMA required administrative forms, our DAP forms. These are the forms we need here at PEMA prior to being able to pay you down the road once your project is authorized and funded. These are applicant entity specific, where I know, and we'll get into it a couple of times here, acknowledging the consultants that are out there. But the program here, PEMA and FEMA, at PEMA is the applicant's agent is that primary point of contact at the entity, the private nonprofit applicant. We require that applicant agent to be an employee of the applicant. And as with private nonprofits, your chief executive can designate themselves, or they can delegate down. And we typically see that where the municipality level, the mayor designates the secretary to do this work, to work with PEMA and FEMA to get their reimbursement at the flood. And many times they come to this briefing, they see the things they got to do, and they go, they go back the next day and dump the packet on the secretary's desk and says, hey, or the public works director's desk and say, hey, take care of this for me. Not a problem, but again, the agent is designated. They're going to have the signature authority to speak for the agent, for the applicant. They're going to be our point of contact, our go-to person. And then the agent may also have somebody helping them. That's fine. If if you're the agent, you can certainly, if you wish, delegate down to somebody in your department to actually do the FEMA uploading to the portal, filling out the documents that are in there to be done. Again, all your call, but when it comes to point of contact, who we talk to, who we discuss work with, it's going to be that applicant agent. Applicant agent is going to take care of and sign the agreement for financial assistance, very similar to a grant agreement, our contract between you and PEMA. Lengthy document. We don't need the whole thing sent to us, which we'll get into here in a minute. But the important pages on the DAP2, DAP1 is just a one-pager that, the CEO with their name designates so-and-so as the agent for this entity applicant. DAP2, then they take front page, cover page is simple. Who are you? Contact information, address. Page 7 is the signature page where you're agreeing to all the terms of the agreement, and somebody there at your facility attests, witnesses your signature. And then the last page of the agreement, attachment G. What happened to the MENT? We have attach G. Where did we lose the MENT out of there? Attachment G, the last page of the DAP2, is your DUNS number information. Being already have PNP and grants, so I'm going to guess you all have a DUNS number already. So we're not going to have issue filling that out. If for some reason you don't, here's the address to go to. If you get to an address, if you just Google DUNS and you get to an address and they're charging you, you're at the wrong place. You do not need to pay for your DUNS number. So close that site out and go to this site to get that if you need one. So we have the one pager of the DAP1. You got 3 pages on the DAP2 that I'm going to need, because as you can see here in the bold ink, I need page 7, the original inked signature. So seeing I need that one page, you might as well keep all 5 together, because we have one more page to talk about. Please do. Patty, our disaster reservist, retired Commonwealth employee. I have back limited time helping out with getting these documents in, accounted for, signed, executed on our side, and then back to you. Would very much appreciate if you keep all these 5 pages together when they come in. So that way we can circulate them, especially the next page. Very important, Pennsylvania electronic payment form. This is your bank information. We don't do checks, we do wire transfers, automatic funds, electronic funds transfer. So we'll need that information on there. We need a SAP vendor number, Commonwealth. If you are not already receiving Commonwealth funds or anything and you don't have a SAP vendor number, there's a phone number and or address that you can go to. Phone numbers on the form itself. They came out via email the other day to your Survey 123 contact. And they're also available on our website. So once we have all 5 of them completed, filled in, here's our mailing address. Again, list the 5 we need, 3 pages from the 2, the 1 and the PEP. Put all 5 of those in an envelope to this address, please. Once it's executed, the DAP2 signed here, Patty's got to upload the completed one to your portal site. So we'll, and then and send you an email that it is there for your records. So as we talked, it is a reimbursement program based on your actual documented costs. Duplicating funds is a no-no. This are restrictions by federal agencies has kind of been relieved for this COVID. Typically in a flooding event, storm event, damage, anything, certain federal agencies have certain responsibilities and the authority to pay for them. And if it doesn't fall under their authority or responsibility, they won't pay for it. And neither will the other ones. It's, they basically point fingers at each other. It's their responsibility. It was suggested to everybody from the start, and they have graciously agreed that this is everybody's authority, everybody's responsibility. It's all federal money. So why get into crossing agencies' responsibility? There's no such thing in this event. So that's made it a little simpler. So all we now need to do, and if you can remember, that was at the start, that was one of my main reasons for holding off of bringing you into the system, was my reluctance, because at that time, federal agencies were still maintaining responsibility and authority and recognizing other agencies' responsibility and authorities and not allowing to pay for others. So once that was relieved, as I messaged out to you, that made it a lot simpler for us to do it. So now we just have to make sure we're not double dipping, that, that case of masks wasn't paid for already under other federal funds that you now want to get to FEMA, or that funding ran out or that grant ran out before this paid for that. If it was under another grant program and it ran out of money, again, it should have been under that grant. So we're just gonna, that's why you will be accounting for your federal grants and where they went to. That way, because a year from now or 2, many of us are going to be audited, whether you get your own in-house audit that you do or an OIG audit from Homeland Security. And that is very thorough. We're going to take the time now to make sure we do things correctly as best we can, dot the I's, cross the T's, so we don't have any issues. Some of the other funds, all good links. We checked them the other day. So if you, again, you've seen a lot of these already. They were messaged out from me. HAP has been putting out links to you. But if you are still looking for other things, there they are. Slide on procurement. Another learning things we found was one of the applicants yesterday made the comment, more of a comment than a question, on what are they going to do because your procurement doesn't fall into federal CFR 200. So we're going to have to look on that as a case by case. What we do have out of this, though, is this was an exigent circumstances for emergency, and there has been some relief given to federal procurement standards. The big thing is that you follow your own. We move through this and you followed your own standard procurement as you do any day. We're not going to see where you're going to have any issues with that. It's deviations, then we're going to have to maybe have some explanation as to why and how. But again, with that exigent circumstances, as long as it's reasonable. If you're looking for some information on federal procurement contracting, you say, we'll do a web search, FEMA PDAT, and that'll give you on their procurement. And there is some WebExes coming up from the FEMA PDAT team, and we'll get those messaged out when we get them. They come out periodically, but there's some WebExes already out there, YouTubes on the different aspects. Okay, so we're out of the eligibility. We're going to start talking about projects portal. Again, active participation through that, getting you in. We're having, as you turn in documents, again, we'll be working with you and we'll be in contact if there's anything else we're going to need out of it. But right now we're doing our briefing. We're going to get you, and we'll talk about it here in the next couple of slides, your portal, get you the invite and what that looks like. Then we're going to talk about, at the end, we got some more training for you in a couple of weeks to talk about how you do your project inside the COVID environment in the FEMA portal. Everybody gets to review it. You're going to review what's in there. We review it at our end, and as does FEMA. Everybody signs off on it once everything's taken care of, and then it gets approved and obligated funded. So this is just the process through that. The cost, federal costs there, 75%. Is what we get out to you for your project. The 25% from the Commonwealth, we hold on to the end till we get the project closed out and the final grant documents in. Again, more that we will talk about when those periods come up. So y'all, everybody needs a portal account. There are a few EMSs. We used the portal for the first time out of our August 2018 flooding event for 11 counties. We didn't have any healthcare applicants. It's a flooding event, and luckily none of them were flooded, so we didn't have any applicants. We did have some EMS companies that may have been in that event and are on today's program for this event, so we'll talk to that here in a little bit. But if you've already set up your account in the portal, it's still there for you for this one. So as some of you found, when you tried to go directly to the portal, you got a stop sign there at the beginning. Because of all the different, as we kind of alluded to a few times, the different requirements private nonprofits have to do, requirements to fulfill in order to get into the portal, have final access. So the first thing is this invite. This is what the email will look like when it comes to you later in the week. We're planning on right now to start putting these out on Thursday. Is our plan right now. Things change for some reason, we'll message that out. Watch your spam. Many of you, as you know, when you were saying you weren't getting anything, found our messaging in your spam junk folder. So if you can approve those once they come in, or if you haven't already, so they make it to your regular folder. This is what it'll look like. You'll click on this link and create your account. Pretty self-explanatory as you go through. It's fill in the blanks and click and submit, upload documents. As it says in the bottom, it's best when used with Firefox. Google Chrome does not work well in Explorer. It'll work, but you won't see things that you need to see for some reason. And things, text boxes, fill-ins become ghosts. These are the items. Again, we're getting you in as FEMA is determining that you're an eligible private nonprofit. So as we've messaged out to you, and hopefully you've spent this off time gathering these documents. So you're going to have them ready to upload here in the coming week to your portal. As you're setting up your account, you'll be queued up to upload these documents, whether it's your 501, and there it is there, 501D. That answers our question from yesterday. Look at our own slides. That was one of the questions. Our state issued Treasury Department document. Something you have, proof of ownership, legal responsibility of your facility, as we talked of back at the beginning, that you own the facility. Your incorporations, we're not talking schools, and insurance policy. Very few, we're not expecting insurance to come into play. I doubt anybody had pandemic insurance, but it's still a FEMA requirement. Forms within the portal that you'll fill in is the PNP questionnaire. It'll ask different things about your facility, your applicant status, where you're at, and also you'll fill in your RPA, which is a request for public assistance. That is your first real document of FEMA. Typically, we have 30 days after an event to get those in, but obviously because of this peculiar nature of this event, that's not realistic. Typically, that's a one-pager. Old days, we collected that and we're out doing this briefing shortly after the flooding event. I'd be set up doing this in person as we discussed, and we'd pass this one-pager out, and you'd sit there while we talked and fill it out and turn it in while we're there. And that got you into FEMA system. That was manually entered in. Now we're this age, we're getting everything electronic. So I talked of those. If you got any EMSs that were in, and that was, here's the DR in the first bullet, that were in DR 4408. If you go into your account, you'll find the ability to do the dashboard already and get to your RPA. Once you're in there, there's resources. It's being able to find them. They used to have a resource tab. Now it's a question mark that you click on to get to the resources and the different resources within it. Again, slide for your reference later on. This is for your information, not something you have to worry about, but need you to be aware of it in case you run into it, hear about it, read about it somewhere through the process. Emergency protective measures do have a 6-month timeline on them from the declaration date. Typically, this is not typical. Again, a flooding event, you're looking at the emergency protective measures of a flooding event, those life-saving activities. We're out at 2 o'clock in the morning pulling people out of their second floor windows, blocking roads, or doing debris removal. You have typically 6 months to do that. We still have those requirements, but luckily I have the ability to do a blanket granting 6-month extension of that time period. We have all expectations we'll be doing that. We already have an Outlook calendar meeting set up mid-August to discuss, where we did that back after the declaration, thinking back then that maybe by then we'll be somewhat out of this. But I have all indications is PEMA will be issuing the 6-month extension to everybody. We will message that out to you once we have done it. I've got to notify FEMA, get their concurrence, and then we'll message out that we have a 6-month extension and what that date is for doing, again, where work can be done. Again, starting on January 20th. Right now, it would have to be done by the September 30th. That's not realistic, so we'll be taking it out 6 months. After that 6 months, we'll have to officially request FEMA to do that. So we'll go ahead and we'll have another Outlook, a reminder in once we know when that next one is due, and be ready to do that if we need to. So you had your PNP documents that you're going to have for your portal, setting it up. Hopefully you've taken the time to grab those, assemble them, get them together, get them out of the lock boxes. And now you have these are going to be for your project down the road. Not something you need for setting up your account, getting your PNP documents in, completing your RPA, getting approved as a eligible private nonprofit applicant. These are documents you're going to need for your project a couple of weeks from now. But good for you to see them now. So again, while you have some time, you can start pulling those things together. Your insurance is already going to be in. But if you had it put any in, if you had something that went in for insurance, statement of loss. What did you get for reimbursement? There may be a deductible there that is eligible. That's typically what FEMA pays afterwards. We get into flooding events. We have flood insurance coverages out there, but there's always a deductible. That's an eligible FEMA expense. And then the rest of these things as they're listed here, you can start assembling. Wow, that's a busy slide. I'm not reading this. I am certainly glad I'm not a slide reader. This is here for your reference for doing the projects, and you will see this again. Getting into descriptive. Initially, it was a brief description of what you did, but as we found out for those downrange, reading and reviewing and approving your project, brief description did not mean thorough description of what you meant. So with FEMA's guidance, we came up with this here that we're putting out there for you, so you have some time to read it later on. So as you're putting your project together, some of the expectations of what FEMA would like to see from you. Sorry, I'm not going to give you the time to read it now. So talking about your project worksheet, that descriptive is going to be on here. Your project worksheet that you're going to develop within the grants portal defines your cost. It determines the eligible work. So that's the most important thing. I always tell folks, focus on what work you did, the eligibility, describing that. The costs will follow that. Having a clear understanding of what you did, why you did it, with what, for how long, and then at what cost. And again, you will be developing this in the grants portal. That's the future training that we will talk about here shortly. Pretty simple. We have folks already doing it from the municipalities, school districts, and it's going very well. We're not getting any bad feedback back of issues with it. So not something to get apprehensive about. Oh, that's right. Back in the costs, I realized I skipped over this. Back in the eligible costs, you probably remember seeing, if you do, there was a management cost bullet. And you might have asked, why didn't I touch on that? And I apologize, but I am now. Probably because I knew this slide was coming. Good news. for your time sitting here today. If you are going to be the person ultimately doing everything for this event, turning in the documents, putting everything together, this will be possibly your first entry on your spreadsheet for eligible, reimbursable, administrative costs for doing this grant. It pays straight time. It pays overtime if reasonable and necessary. It can be 1 or 2 of you within your facility. And it's based on your actual costs up to, capped at 5% of your eligible project costs. So once we get downrange a ways, well into this, where we know what your final actual eligible project cost is, and you could have 3 or 4 projects, different things. You could have just one large project. It all depends, but we add them all together, and you get up to 5% of that to go use towards your management cost. Your time, and other employees within your department's time doing all this. You may already have time on the clock assembling those PNP documents. So think back. You spent an hour here, an hour there, pulling those documents already together, or knowing what's eligible. You've already worked on spreadsheets, computer printouts, system printouts to have ready to turn in. Think back of time you spent on that and enter it into some sort of document, spreadsheet, where you can start tracking your costs doing this. If you have a consultant that's going to be uploading the documents for you, that's where their fees will come from. We've had conversations that, no, I'm wrong. It comes out of a project worksheet that's written specifically for them. That is the old way of doing. FEMA changed the rules a couple of years ago on management costs and consultant fees, and they all now come out of your management costs. This is probably the 4th rendition of how FEMA does management costs since I started. And it's working pretty well. It's a separate project at the end that'll be funded at, again, the 5%. It'll be written for the 5% of your total cost. And then you'll receive what you actually spent. That's why we'll need those documents from you, that spreadsheet showing what you did. You know, if for some reason we're doing work that's 100% completed and you're not planning on doing any more submissions, then we will write it for your actual cost versus an estimate. But we're going to pay out at the end on your actual costs. As I alluded, grant closeout. As you realize, all grants get closed out at the end. We'll be doing that here. Your project specialist, Russ, John, or Kevin will help you through that process. There's a form. What's good about the portal and doing this on actual incurred costs is we're probably going to already have all those backup documents to support those costs already in the system. So when we get to the end, there's going to be very little for you to turn in. Typically what we see missing when we go in, FEMA does that final review, again, making sure the I's are dotted, T's are crossed, is that we may have been missing during project formulation proof of payment. Proof of payment is not needed. If you've got the invoice and you're submitting, you're certifying it's an eligible cost, then we'll use that invoice for the cost. You will be required to show proof of payment on that cost. So if you don't have it at the time of the project, you will be supplying that, whatever it may be, canceled check, something out of your system, your bank, whichever, to show that those costs were done. expectations from us and FEMA for you, and don't worry, there's one for you from us. It's a very interactive program. You must maintain contact with us, be actively involved through this. We were talking this morning from the original start. There was, how many did we have or inactive? We have to go chasing down 27. We have 27 applicants that started off, all PNPs, and for one reason or another, the line has gone dead now for 30 days or more since we've requested documents. So that's something, unfortunately, we're going to have to start spending some time on, is determining what is up with them. Why? A lot of times, change of personnel. One guy, gal was doing it. One employee was taking care of this. They left their employer. Nobody's picked up the ball on this. We find that out many times when the line goes dead. But we do need your active participation through this to meet the timelines as things go up. You know, you'll be setting the pace of your project, getting it in. The sooner you get things completed, the sooner it can get through the review process, and sooner it can get paid. Again, all lengthy processes, but ultimately we get the payout. What you can expect from us, our active involvement. As many of you have already seen, you will receive calls from me when you leave messages, or to John, Russ, or Greg. You may receive them in the evenings. You will reply back to the emails. If you call us and leave a voice message on the phone, on our desk phones, please leave a detailed message, who you are, your entity, a county you're in. With 67 counties, it's highly unlikely I'm going to have a hospital healthcare with the same name. But when it comes to municipalities, we have, as you know, many municipalities in the Commonwealth with the same name. So please give us your county, and if you can, brief description what you're looking for. It may give us time to look something up for you. If it's too detailed, just kind of allude to what it is, and we will get back to you. But leaving a voicemail on our phone, desk phone, generates the audio file to our Outlook email. So no matter where we're at, we can get access to your voicemail. Or you can email us. You have their email address too. We'll get back to you in a couple of days within an answer. Always love seeing the reference sign, so I know I'm getting close and I can stop and take a drink of the coffee. Some links for you. The guide, public top there, very big document on the whole public assistance program. It's a PDF and searchable. Very easy document to use. Bottom bullet, the fact sheets, kind of a catch-all for everything, all FEMA's fact sheets, policy sheets. You're going to find the one on healthcare at this site here. So you have your project specialist contact already, but here's our generic, our email, our mailing address again, our resource account email address. That one comes to all of us. The 800 number to an administrative assistant. Our websites, regular PEMA website, second one, recovery, that's with our COVID specific. That's where you're going to find the forms. We're recording. We recorded yesterday's 2. We're recording this one, and 2 o'clock. We'll take the best one recording and set it up there on our website also in the next couple of days. The one that's there now is the one we did for the other public assistance entities, the county, local governments, and other private nonprofits. But your healthcare applicant briefing will be up beginning of next week once we get through the rest of these. And then FEMA's website. So upcoming training. So we've gotten through today's briefing. Congratulations. If you're still awake and with me. Next is going to be getting you that invite, having you do the portal, set up your account, upload the documents, fill in the questionnaire and the RPA, get that submitted. It'll come to Russ, John, or Kevin to look at. They're going to make sure that all of the documents are there. FEMA needs, if not, get back to you for them. Then they'll pass it on to FEMA. FEMA has a review process then that they check through everything to make sure you're an eligible private nonprofit. And then they will bless you, which then gives you access into the portal with the username, temp password. So that's what we're going to be doing over the next couple of weeks. 2 weeks from now, we're going to get back together. You do not have the invite yet. We're waiting for these WebExes to get over before we send out the next WebEx registrations. So it'll probably be, what are we thinking, this afternoon or tomorrow morning? We'll get those off, John.
Get them off.
Oh, there, we do have it on there. Thank you. Kevin's pointing out, Chris, right there, last bullet. It's right in front of you. Read. So tomorrow, we'll get you the registration email out for registering for the 2 trainings on the 4th and 5th. This will be for large projects. If you've got, I'm thinking all the healthcare is going to have cost over the threshold of $1,031,100, which is a different project than the small projects, which are between 33 and the 131. Quickly on the small projects, if you're on here and that's where you fall in on our website and at this YouTube link is the previously held training. This is coming directly from FEMA. They've been gracious enough to give us their trainer back again. He was tasked over to another area, but we requested and they're gracious enough to let Tom come back to present to you next in the 4th and 5th on how you're going to do what needs to be done, what it looks like. It's screenshots. You'll get them ahead of time to follow along. It's similar if you use, not to be an endorsement, but if you use TurboTax, the project and the portal is very similar to filling in your TurboTax online. Again, we'll get that off to you on Thursday. So if you have any unanswered questions, we'll give you some time to get them typed into the chat room. And then we'll go through them. Keep in mind, we're here as your advocate. You've got your contact. As we're progressing through that, if you start having heartburn issues, concerns, that's when it's time to pick up the phone or shoot an email. We can't help if we don't know about it. That's what you're paying us in your federal tax dollars to be here for, is to help you through this. It's, again, sorry for the pun. It works well in the municipalities, but this program is not brain surgery. Voluminous on the paper, big paper push, but everything is going well. Again, we've got 500 or so applicants ahead of you in. There's about 120 projects now. We've actually have 4 approved and funded already. So it's not going to be a difficult process for you. Questions?
We have one question. Does eligible labor cost for temporary staffing include staff brought in to cover staff out on paid sick leave due to COVID?
Pay out on paid staff brought in. Again, necessity, we'll certainly look at it. I'm going to bring Jeremy in. I might go right to the lifeline here. That's good question. Nuance to the backfill. Jeremy, well, we're going to get you queued up here. Jeremy is my FEMA counterpart in this, my lifeline. so we'll go right to that. So if you go ahead and unmute yourself, Jeremy, and weigh in or type in. So as I said, we're recording this, and we're taking all the questions we have for the other day. Are you with us now, Jeremy? So we're going to take all the questions we have. There is out on the website when you go there an FAQ from the municipality level. So we'll do an FAQ same sheet, put it on our website. We also message it out. I don't think you're gonna, my initial inclination, I know, again, when I answer questions, I've been working this FEMA program for a long time. So I've always try and think when answering a question, what they're gonna come back with before I answer it. Again, it's gonna be a why. I'm thinking it's going to be a tough one in all seriousness because again, you're not backfilling somebody who's working, you're backfilling somebody that's out sick, that's on paid sick leave. FEMA has, and you will see it probably a few times through this program, an increased operating cost. They have different uses of that, and as we progress through the system. So we'll get you an answer on that in the FAQ, for sure. Again, we'll go, if we don't get anything, get it turned in, explain the necessity. Again, it's going, in reality though, I don't see in the different pay policies where that one fits in like a true backfill. Another question?
Can you provide clarification on the order of submitting the DAP and the RPA?
RPA first. Typically, good question. I thought about this before. Typically with PNPs, we have you wait till you're an approved PNP to get these then the DAP 1, 2, and EFT into us. I don't really, again, sometimes we have iffy PNPs, whether they're going to meet eligibility. For the healthcare, obviously you are. So we're just basically parallel tracks. Definitely want to get your portal done first, get your RPA in, again, because the timeline of doing that, doing the training, doing your project, going through a review, that's going to be month with parentheses S, months. Getting that through, so you'll have plenty of time then to follow up and get the DAP in. Again, they're not difficult to do. Next question.
If a provider gives paid time off to employees on the front line as resilience pay, can that be included as an eligible expense?
So it's almost like leave. You're giving them leave. Again, another tough one. What do you have in your pay policy on it? Is it things you've done in the past? But if it's just like a bonus for doing the great things they did, it's great you did that, but that's probably going to be something you can take to your other CARES funds. Again, where we can, everybody's responsible, everybody's got the funds, but where we see funds better, easier, taken care of by another grant, FEMA and ourselves will be looking at pointing you towards those other grants that are out there and others still to come. Next.
No other questions right now.
So one thing I didn't touch on is on your project. I was going to wait to see if someone that passed the questions. Come project time, we had the question, start thinking about what period of costs you're going to submit. We know it started on January 20th and go forward. At some point, we have to stop chasing our tail. So you need to, for your own facility, come up with a date where you're going to cut off capturing your cost. You're going to continue, but what is your first submission? What's the time period for your submission? And using it only as an example, let's use July 30th, June 30th. Remember to use many dates, so I'm not questioned about them later on, as I got last time. I was, well, can I pick a different date than July 30th? Yes. Any date you wish to pick to cut off. What is best for your system, your entity. So it'll be, for example, again, January 20th to June 20th is your first cutoff. And all those costs in there is going to be your first submission. It's based on actual incurred costs. There's no estimated costs in there. It makes for a nice, clean project going through the system. The 3,300, you only need to meet that threshold once. Your initial submission to FEMA has to be above the 3,300. After that, follow on versions, which we'll do for your project, because you're going to have that, January 20th to date of your pick is going to be your first submission. And then from that date of your pick on to the next date, somewhere down the road, and we're thinking quarterly, you can then submit those eligible incurred costs you've had under the program, and it'll be a version. We'll just keep adding it on to the project. So that way, you only meet the 33 once, and then we just continue on. So something that you can start working on internally is, what is that date going to be that for your first submission? What is that first time period where you have all the documents already assembled, ready to go? Can you wait until a date in the future and use that because you got a big expense coming up? Fine, wait, or not wait. Do the rest and pick that one up in the next time. It all, again, depends on your internal needs, requirements, as to what date where you pick. But we're not in this first round doing estimated costs in the future, because a lot of them are probably not going to be, this is a temporary emergency protective measures are for temporary work, so we don't get into permanent stuff. Guidance as to buying PPE for future use next year, the following year, is still up in the air, and definitely more covered under other cares versus FEMA's. So we know there's issues with future purchases. We're already falling into that with schools looking to buy stuff in the future for future use. And then now they have other CARES funds coming out for that. So we're going to be focusing on actual incurred costs. That'll keep it simple. These are things you did. You don't have to get descriptive then in trying to show why you should be able to buy something in the future. We're going to stay for now with the actual. So during that, was there any other questions popped up?
No more questions.
No more questions. Oh, good. That means I'm done talking. Thank you very much. Now, if you see after this that you have other folks that need to see this, need to hear this, we have the next one at 2 o'clock. There's still time. You have the links probably still in our emails. Yeah, there's a good point. If your email's messaging, if you're not, set yourself up a folder to pull all these messages over into from us so they're easier to find later on. But if you got somebody else you think now after seeing this and you're going to need help and you want someone else to watch, they can definitely still get registered for the 2 o'clock. There's room. Or they can look forward to next week's when it's there on the website recorded. Your call, your choice. Nothing? Done? Alrighty. That's it. Thank you very much. We're done here in Harrisburg. Be well. Bye-bye.